My name is Dr. Ashley Jones. I was the Critical Care Fellow in 2018-2019 and have now returned to my general surgery residency as a chief resident for my 4th and 5th year. I actually came here as a medical student to do a visiting rotation, and I really was drawn to the trauma service here. It's a busy trauma service. I actually did a shadowing of the resident team and went through a trauma activation and really just enjoyed watching, and the residents seemed to be really happy here and seemed to be learning a lot and very comfortable with what they did. From a critical care standpoint, this program is really anything you want to make of it. We are a busy level 1 trauma center. We see a lot of penetrating trauma. There's a lot of operative experience here. If you come from a place where there wasn't a lot of trauma or critical care, this is a great place to get your feet wet. You leave here knowing how to take care of critically ill patients.
I'm Chris Watson. I'm the Program Director for the Prisma Health Surgical Critical Care Fellowship. I trained here as a resident and left to do my fellowship at the University of Virginia in Charlottesville, and came back and 2 or 3 years later took over the program. There's a couple of things that make this program unique. We actually designed the program around what the fellow needs. We've noticed that not every resident is the same. All the training programs are a little different. In order to give the fellow what they really need, we have an interview after the interview, and when they've already matched with us, when we decide what the program needs to look like for the year. We have only one fellow, and so you'll really get to know our faculty. You'll work really close with those and really develop a mentorship with these people. We have it so that the residents and the fellows really do have different roles here, and so there won't be a lot of competition for cases or for patient care. One of the things that we really wanted to focus on was collaborative education for the fellow. And while all programs are required to have a desk for the fellow, we had our fellowship desk placed in an area that has the pharmacist, the dietitian, and one of the faculty members, usually me. And so when the fellow's planning patient care, they can turn around and we can all talk about it at the same time. And it helps reaffirm and focus that thought in the residents, so they really latch onto that information.
I've really enjoyed, being in Columbia. There's multiple restaurants here. It's a very up and coming area. There's multiple breweries. There's always something to do on the weekends. And then if you're trying to get out of town, we're an hour and a half from Charleston, an hour from Charlotte. You can get to the mountains very quickly. It just seemed to be in a great location. So I think the most inspiring thing that I've encountered here is how this hospital system embraces the patients in the community. The trauma service rallies around their patients and supports them through the entire hospital stay, them and their families. And to watch, a patient come back after we thought they weren't going to make it into the ICU to, say hello to the nurses and the care team has been something that's been very inspirational to me.
So one thing that we're proud of here is that we've been able to keep a lot of our fellows on as faculty. Of the 7 that we have currently, 4 trained here and decided to stay here. They love the area, they love the hospital system, and we all are very close and develop close relationships with each other. After completing this program, a fellow is going to be prepared to do every aspect of surgical critical care. We start the resident off with a lot of oversight, and by the end of the year, they're running the ICU independently. We're still there if they need us, sitting in the corner watching, but they are running the show at that point. So the day they step out of their fellowship, they're going to step right into being an attending.
The resident team, we've always had each other's backs, and we all get along. We're a big family. We're away from all of our families, so we've become each other's family.